what has been what have you learned so far, basically, right? Yeah. Sweet. Oh, I see your comments, Asma. Please, if I mispronounce your name, please just help me. Thank you. I see your comments. You say it has been a difficult week. Do you want to share a bit on that? Is it regarding the classes, the time schedule, or is it something else?
So I would speak in my short time here. I want to speak about Asma. I know that she probably doesn't like to talk. She probably would text a response. So expect a response to be in your text or in the chat box actually, and not physical one. I'm calling her Asma here now in case she wants to say something or she wants to give you a rebuttal to what I just said. Right. So that's
Uh,
it. That's what I wanted to say actually.
Good afternoon, everyone.
Hi,
Uh,
Asma is finally talking. Yee.
yeah,
It's good.
I
Hi,
don't.
Good to hear your
Asma.
voice finally. Ooh,
Sorry, I don't like to talk much
I know.
because my English is not very good.
We
So
love it.
that's why I just prefer to text you all in the chat. Well, it has been a difficult week. It was difficult just for me because the timing was a bit difficult because the kids they are not at school and between 12 and 3 it's lunchtime, etc. So it was a little bit difficult for me just for that. But for the for the summer school, I think it's very rich topic, and I really learned a lot. Unfortunately, I couldn't assist during this week, and I was expecting to find the videos in the YouTube channel, but unfortunately, I couldn't. So, well, I hope I will be able to follow you all today, and that's it. Thank you.
Okay,
Thank you,
thank
Asma.
you very
Thank
much.
you. It's good to hear your voice finally. Precious, please, you have the floor.
All right, thank you, Scott. Thank you as well for speaking. You have a lovely voice, by the way. And I completely understand the difficulty. I completely understand. I can relate. I can relate. Sorry about that. Okay, so regarding the classes, I'm sure that the recordings will be made available soon, right? So just keep checking the YouTube channel and you'll be able to follow through on the parts that you missed. All right. So is there anyone else who wants to share what has really stood out for them, right, in the course of this summer program? Anyone else? Or should I call names? Should I mention your name? You know, there's nothing, so there's no wrong or right answer, really. There's no wrong or right answer.
Yeah, for me, um, getting to know that it's training AI models and putting it into use goes beyond just just looking for a model that can perform very much better. There are other considerations that are kind of needed to be put in place, particularly ethics and what you are training. Are you transparent with it? Are you sure there are no black boxes? And are you sure as a developer would you want to be accountable? And beyond that, I think for my group, the project topic seems very interesting, reading the abstract and giving us clues on where they want us to go to. Yeah, I find it very interesting and encouraging. So yeah, to the team and to the person that could put the abstract and those research, a big thumbs up. And I think also myself and members of my group, we are grateful for that. So thank you.
Okay, thank you very much, Olatunji. Kusho, how would you like to be addressed? Emmanuel, I see 3 names. So how do you prefer to be addressed?
All right,
Is it
Dami is okay.
Dami?
Like,
Okay, cool. All right, thank you very much, Dami. And yeah, the conversation around AI ethics is actually really profound, right? And I say that because particularly I work in the data protection space, but then beyond, I was in a meeting, like more like a hangout for data protection officers recently. And, there was this conversation that arose around, what are the areas of divergence and convergence between AI ethics and data protection, right? So, I mean, while data protection just gives you the hard law, right, gives you rules, principles on what you should do to comply, right? It's also important that organizations there are certain ethical questions that we need to begin to ask ourselves, ensuring transparency and explainability, and a bit of other things that organizations need to put in place to ensure that they process information, or that when they deploy or develop AI models or AI tools, that these tools and models they fit perfectly into these ethical principles, regardless of whether the law prescribes that you need to do this or not. So it's not a case of, okay, ticking a box, okay, data protection, or maybe GRC, maybe some certain compliance requirements. I need to do this, and then you do it, and then you check the box. You also need to ensure that if ethically you should go above and beyond what the law prescribes, that you do that. I think that's actually really important, this conversation. So thank you very much, Dami. Is there anyone else who wants to make a go at this? You want to share what you've learned, or you want to give feedback? It could even be feedback, really. I just want to hear our voice. You're hearing me now, I'm talking. Let's talk. So our facilitator will join us soon. So before he joins us, hi, Bolanli. I mean, Bolanli, you've actually been quite responsive in the chats. Do you want to speak? Would you like to? All right then, Bolanli, that's fine. Completely understandable.
Can I speak again?
Oh, please do.
Thanks. So what I want to say is that the main reason why I'm following this summer school is that I'm working in the Faculty of Medicine and as a professor of informatics. So the main challenge I have is how to convince medical teacher, medical professors, and medical staff to trust me with their data. Uh, um, and I was thinking that maybe following the summer school will give me the tools to convince them that if they trust me with the data of the patient, and that we could have good results that can benefit research and medical practice. I don't know if you can help me with that. If you have any idea how to convince them with the importance of sharing data, and if I do you think that in the end of the summer school I will be able to develop a framework or a model that will make them give me the data and trust AI projects, because I know they have enough data to make incredible AI project, but they all have this kind of how we can say des freins. Sorry, they have this kind of barriers, and they don't trust external people with patient data, and what do you think? How can I make them trust me to work with in such projects?
Okay, that's interesting. That's interesting. So our facilitator is here with us now, and I'm sure he heard you, right? And I believe that by the end of this session. So today we're treating AI and healthcare, so fits in perfectly. So I'm sure that by the end of this class, that your questions will be answered. I'm pretty positive, right?
Thank you.
All right. And if it's not, you can always raise the question again, or I would nudge the facilitator, if that's okay.
Thank you.
All right, then you're welcome. Okay, having said that, we'll move straight into the business of the day. Give me a moment to share my screen. Okay. Hello, everyone. Please let me know if you can see my screen.
Yes, we can. Yes.
Okay, awesome. Thank you. Okay, so we're here again today, another session, and you probably already know this, but we need to, so this is the AI Ethics Summer School, yeah? So we've been on this course for over a week now, learning, moving from topic to topic, right? So I will just go over, so this is who we are, right? So we are the Pan-African Center for AI Ethics, and this organization, we are non-profits, right? And we're dedicated to, I mean, as you can see, or as you've realized, we're dedicated to ensuring the ethical development of AI and practices in Africa. So we're all about ensuring that, I mean, we're in a world where currently there is a huge proliferation of the use of AI. I mean, people use tools, and I mean, it seems like AI is selling, right? But then again, there are certain risks that are prevalent in the use of AI. And this is what this organization is about. We're about ensuring that when AI is developed and deployed, that it follows certain ethical standards or practices, particularly within Africa, right? And tool we use in passing this across is educational programs, educational programs like the one we're having now, research initiatives, policy advocacy to ensure that AI technologies benefit all segments of the African society. So it's not the case of big data companies using AI tools to harvest data from Africa, right? That AI models and AI technologies are also used to benefit our society. So this is what our commitment is, right? So yeah, moving on. So as an organization, this is our vision to reshape the future of Africa's AI landscape to reflect the ethical and responsible dimensions of the African society. So this is what we're looking at, right? And the mission is to ensure that AI designs, deployments, and use align with Africa's ethical standards and values. So, I mean, when deploying AI, it's important that there are certain standards, values, I mean, ethical standards, right, that are prevalent in the global north. It's important that when coming to this side of the world, right, in the global south, yeah, I think that's what we are, yeah, the global south, that there are particular values. There are values that are particular to us. So our mission is to ensure that that AI designs that are targeted to Africa aligns with our ethical standards, right? So this is what we do, yeah? We're committed to ensuring the ethical development and advancement of responsible AI. So we focus on key concepts relating to fairness, accountability, transparency, explainability, and overall human welfare, basically. Okay, so having said that, this is our social media handles. Feel free to follow us on YouTube, subscribe to our YouTube channel. We're also on LinkedIn, on Instagram. Please follow us on these social media platforms and we can continue the conversations from there. Okay, having said that, I would now introduce our speaker for today, or more like our facilitator. So our facilitator for this session on AI and healthcare is Damilola Awotula. I hope I'm pronouncing that correctly. Damilola Awotula. So Damilola Awotula is a lawyer and a doctoral law researcher at the Faculty of Law, McGill University, Canada. He practices and researches international law. So his practice area includes research on international law, cross-border financial flows, artificial intelligence, and law and development. So he will be handling this session on AI and healthcare. Please let us all give Mr. Damilola Awutula a virtual clap as he takes the stage. Thank you very much for being here with us, Damilola. And I'll be ceding the floor to you right about now. Thank you very much.
Hi, good morning. I hope you can you all hear me? Good morning. Can you hear me?
Yes, I can hear you.
All right, thank you so much.
Yes, you're audible.
All right, yeah, thanks for that. Yeah. So good morning or good afternoon, wherever you're listening to me. It's a morning here in Montreal, Canada. I'm so excited to be facilitating this session. And first of all, I want to say thank you for inviting me to the team. And very excited to be supporting you guys with this very important initiative. So I'll just go straight because I think we spent some time on other things. I'll go straight to start what I have prepared for today's conversation. I'm just going to share my screen. I hope I can share my screen. I'm going to try to. Seconds. I'm just going to ask if you can see my screen. If you can confirm via chat or verbal information, that would be great. All right, thanks for that, Rachel. All right, so I really can't see myself, but I assume you can see my screen. Sorry. Okay, yeah, I suppose you can all see my screen, so just gonna go ahead and all right, so just a little bit of background information about myself. Again, my name is Dami, and I'm a PhD researcher at the Faculty of Law McGill. I'm also an FRQ doctoral scholar and an IBA scholar. My research is basically international law. I also do research in law and technology. I do research in law and development, particularly critical law and development studies. Usually from a global south perspective. I also wanted to say that I don't have, a background in in medicine or in sciences, but I sit on research ethics board, psychosocial research ethics board at one of the biggest Jewish hospitals here in Montreal, and my work usually involves reviewing research projects from the medical sciences. Mostly from a jurist perspective, so mostly from an ethical perspective. So just to give you that kind of background in terms of why I think I would be able to, even though I don't have a background in medicine or in health sciences, I do have some experiences that I can share with you to drive this conversation. I also want to mention that anything I do say, it's not, it doesn't represent the hospital that I see ethics, but it's my personal view. And yeah, so I do hope that we can have a very good conversation today. So we would, I don't know why this screen is not working. It's not interactive. I think I have to do that. I'm sharing again, 1 second. Okay. All right. So good. So our conversation today in terms of AI and ethics, AI and health industry would focus on four main parts. We're going to look at what AI is. I suppose it's something you would have encountered numerous times during your training or the summer school program. But I think there's still a lot to unpack, as we engage with the question of what AI is. So we're going to talk about some ontological, review of AI from a computer science perspective, from a healthcare perspective, and from a law perspective. And I always like to give the legal perspective to it as a lawyer. And then the next part would be why do we use AI in healthcare? And this sort of like encompasses questions around what is the benefit of using this kind of systems, the healthcare industry, and the word healthcare here really doesn't necessarily narrows down on medical practices, but it also covers everything within the healthcare industry from medicine to pharmacy to, therapy and all other forms of well-being through institutional means. The next part will look into the challenges and issues that have arisen in terms of the use of AI systems, and this will focus mainly on questions around bias and risk. And then the last part we will look into what we call as global regulatory responses to this issue. So why do we have to sort of like define AI? First of all, and why is it quite difficult to define? So you would have understood so far with the trainings the classes you've been doing, that AI systems, can embody something as simple as algorithms, simple algorithms. And algorithms actually, if you look at the meaning of that word, simply means something that, is rule-based in terms of how to do a thing. It's sort of like a methodology of how to do certain things. So it could range from something as simple as, autocomplete to, machine learning systems or deep learning systems that are really, really passed on high data volume, and they have very strong high predictive capacity. So it's still a very, very misleading term. It's still not something that everybody, you can't really say this is what AI is. It's still sort of within the realm of description of AI systems in terms of algorithms, AI systems in terms of simple algorithms. It could also include high-tech systems that are run on big data, and it could also include simple processes. So it's still a very, very misleading term. It's not something that you can, I suppose, sum up, as briefly as you. It's not a very simple term in the way that many people use it. So it's a buzzword. It existed many, many years ago, even since the 1950s, more than 80 years ago. The question around AI has been among the scientists. And so it's still kind of very fuzzy to say that this is what AI is in terms of a very precise definition. So it actually encompasses a constellation of different systems of varying capacities. It's also sort of like a loaded construct because, first of all, the idea of, and this runs into the next question that I raised there, which is the velocity of questions around artificial intelligence. From a legal perspective, for example, we seem to sort of agree on what artificial is. There's a lot of questions around what intelligence is. What is intelligence? Is a machine really intelligent? Because the whole idea of AI system is systems that have the capacity to mirror human intellect, or sort of like mirror human ingenuity. And we still haven't gotten into that at the moment. Many of the systems we still really have not attained that level of performing general purpose functionalities. They are still very restricted to specific functionalities, but they do not have a robust capacity that fits what we would consider to be human. So it's very, very difficult, to look into questions around what intelligence is. Is it just intelligent because it's able to produce output based on data that has been fed into the system, or it's intelligent because it mirrors human intellect? So these are burning questions that still sort of challenge the AI space. So the goalpost keeps changing. Like I said initially, what used to be AI in many, many years, it's no longer AI. So if you look into the history of AI development, especially from the 1950s, starting with the Alan Turing test, and what we have today, there have been significant shifts. Many years ago, the calculators will be considered as AI systems because you see what they are able to do. They sort of like able to replicate and produce mathematical calculations, in a very fascinating way. So that sort of like mirrors human intellect, but really they are not AI systems as we would say they are today, because they do not possess that, kind of capacity of what we consider AI to be today. So the goalpost about what AI is keeps changing year by year. So what we call AI system today may not necessarily pass as AI systems in the next 30 years because of the increase in capacity. So now when we talk about AI systems as well, there's also a need to sort of like put it into context. And that's what actually, really matters in our conversation today, the question of AI used in the healthcare system, healthcare industry. So context is very important. Systems that are able to perform diagnostic functionalities in disease, patient care, and all of that, they really are not systems that are run on simple algorithms. They are actually in the context of neural networks, or in the context of large language models, machine learning systems. They are really, really not simple systems. A system that is able to diagnose, diagnose particular disease, looking into X-rays or looking into skin lesion, they are not systems that are really run on simple systems. They are simple algorithms. They are systems that are actually highly advanced. So the context of AI within the healthcare is very, very high. You want to talk about like in terms of hierarchy of AI, from algorithms, simple algorithms, to machine learning, to deep learning. Within the healthcare, most of the systems that actually forms the crux of usage are systems that are machine learning systems. So it still comes down to the question of what is AI? I mean, from a computer science perspective, I don't know if you've read about Alan Turing, who is a very famous pioneer in terms of the AI history. He designed this thing, or what he calls the imitation game, which is sort of like how you know what constitutes an AI system. Is a system that thinks humanly, a system that thinks rationally, a system that acts rationally, or a system that acts humanly. And if you read his publication that was published in his article that was published in Mind in 1950, what he titled Computer Machinery and Intelligence, he said that the way to think of what an AI system is, a system where a human being interacts with that, machine, and he's unable to tell, that he's actually interacting with a machine. So that if they put a veil, sort of like a barrier between a machine and a person, and certain questions are asked and it gets feedback, the human being who is assessing or is interacting with the system would not be able to tell that this is actually a machine and not a human being. And so the whole idea of AI system, according to the Turing test, is the whole idea of imitation. That is, the system is able to replicate, is able to imitate human ingenuity. And it's still very questionable whether we have gotten to that level now. And some of these things comes down to the question of interest. If you're interacting with a chatbot, for example, you really tell if it is, a human being, you're interacting virtually with maybe a customer service line, and can you really tell whether it's a human being or a chatbot? For me, I usually know based on the way the responses are, and I just put in human and then transfers me to human. So the question of what AI is, according to the Turing test, is systems that think humanly, think rationally, act rationally, and act humanly. Now, this was in 1950. In 1956, 6 years after the Turing publication, another man named John McCarthy, who is an MIT scholar, defined AI systems as artificial intelligence as science and engineering of systems, engineering of making intelligent machines. So this still doesn't really define it.
Yeah, would have been very good. And it closed, yes. It's like mentorship. We like take a few students.
I think there's a feedback in the background.
I'll look for if I see anything on data protection, because
All right, yeah, thanks for that. So 6 years after the Turing publication, there was a conference set up by John McCarthy and Dartmouth, where they sort of like tried to define the scope of the discipline. And they all agreed, what came out from that conference is that artificial intelligence is the science and engineering of making intelligent machines. These are still loaded. What is intelligence? I mean, a lot of philosophical questions. So why is particularly, AI in the healthcare very interesting? As a matter of fact, one of the areas that scientists started thinking about using AI for was actually in the healthcare industry. I mean, from the conference that happened in 1956, some scientists from that conference actually thought about creating machines that, that sort of what they consider to be human brain, So even from the very early days of AI system, AI research and AI science, one of the first areas that actually came up in the minds of practitioners was actually used in the health. So it's quite interesting that today now it's proliferated into various other disciplines, but even still very leading in the context of the healthcare industry. So using AI in healthcare, examples abound for the diagnosis and clinical care, such as responses to patients with queries. There's a serious problem of misdiagnosis within the healthcare industry. Some of you that have that background know, according to a data from Johns Hopkins, just last year, the overall rate of disease diagnosis in terms of error is 11.1%. And in terms of spinal abscesses, it's around 62%. And if you want to look at some specific diseases like stroke, it's 17%, that there's always sort of like misdiagnosis. So using this kind of systems actually reduces error in diagnosis because they are able to, they can be fed with high amount of data, and they can, sort of like discover patterns that are being used today in diagnosis for cancer, for different forms of diseases within the that medical practitioners interact with on a daily basis. So it really, really does help in disease diagnosis. I'm going to see some examples as we go in our conversation. So it also has some patient-guided use. One of the things it has also done is use what we sort of like call personalized medicine, where patients are able to input certain data about their health history, and then it can begin to provide personalized responses, what they should do, how many dosage of particular drug they should take, and a lot of monitoring that usually would not be able to, because of human with the incapacity to be 24 hours productive. These kind of systems can provide such treatment plans for patients. So, I mean, this is something to be happy about, I suppose. Then you also find it for use in clerical and administrative tasks, such as documenting and summarizing patient, within electronic health. So health records are one of the things that are considered very vital in industrialized medical systems. Every visit you have, you go to the hospital, the medical practitioners must document it. They must keep track of it. What drugs you given, what was the diagnosis, what was the diagnosis, what was the medicine, what were any prescription that was given to you. Everything must be documented. And this actually form, for example, in Canada, 10% of, the job of medical practitioners. And a report last year actually indicated that if this 10%, time that clerical and administrative tasks, if they can reduce, take it away from the burden that medical practitioners have to, face because of clerical and administrative tasks, it could all actually expand, opportunities for up to 5.5 million patient visits in a year. So that's actually very, very, very serious. So this kind of activities in terms of the clerical and administrative tasks really takes up a lot of, the time of medical practitioners. So if you use systems that sort of like automate the collection of records or collection of maybe it's listening to the conversation between the medical doctor and the patient, and then sort of like put up a transcript of the conversation, and the database or the records of the patient, without the doctor having to sit down every end of the day and trying to fill in all clerical duties and administrative tasks. This could actually really support medical practitioners' work. So quite relevant for today's healthcare industry. So it also being used for medical and nursing education, including providing training to simulated patient encounters. Apart from that, there's also sort of like vision for using medical robots or surgical robots, some call it, or even virtual nurses. There is a data from Canada, for example, that shows that there's a shortage of up to 115,000. There's going to be a shortage of up to 115,000 nurses by 2030 in Canada. Canada has a population of 40 million people. It's estimated to grow, of course, more than that by 2030. But even the estimate shows now, with the rate of population growth, that there is going to be a shortage of up to 115,000 nurses. And all over in the world, there's an estimation that it's going to be up to 13 million shortage of nurses. So using this kind of systems as backups or interventions to mitigate shortages in this kind of industry is indeed a game changer, and really sort of calls into question issues around AI system taking over jobs and all of that, because there's actually room for those systems to actually fill, because humans actually cannot meet the daily needs required by the healthcare industry. So scientific research and drug development, like I said, in terms of healthcare, it's we're using it as a very broad concept that includes both medicine, pharmacy, and other forms of healthcare delivery, including therapy or psychology and all of that. But specifically in scientific research and drug development, these systems have actually proven to be a game changer. Current statistics actually from the US FDA shows that it takes roughly 12 years to produce, to conceive the idea of a drug, and go through all the process of research, testing, clinical trials, and approval. And in fact, it takes up to the financial cost, according to WHO, is roughly around 43.4 million to be able to produce a single drug, in terms of like research and the regulatory requirements that are meant to be complied with by the drug producer. So imagine 12 years. So if somebody has a lot of rare diseases where there's a lot of clinical trials, a lot of repeating and trying to make sure that the drugs reduce the risk that comes with the drug. These kind of systems have actually proven to be a game changer, because what they do is they reduce the time, rather than having to wait for 12 years, which is sort of like the standard average time now, especially for drugs that are meant to treat chronic diseases. AI system can actually reduce the time. So you can reduce the cost because it's faster, and it can reduce the time. And of course, the implication is that it opens access to medicine for many other people. So let's look at some use cases of AI systems. I'm just going to show you some examples here in healthcare. I try to pick some from. It's a little bit difficult to find really strong systems that are being used in the healthcare industry in Africa, but there are some that are actually developed by Africans, but they are being used here, or they are domiciled here, but they also have sort of like transboundary applications. So some of the ones that I've listed here is Zero AI. It's a company here in Canada, and they really focus more on pediatric medicine, which is for children. And what they've done is they've been able to automate detection of high-risk medical and surgical patients based on vital. So you put the system on person, or sort of like put it on, attach the system to the person. It can detect, whether the person is high risk in terms of, their medical trajectory, and it could also sort of like provide, sort of like the medical recommendation for the kind of surgical interventions that the patient needs. And it does this by looking into like vital signs. You pass through the vital signs having received it, look into their past medical history and demographic details, and it also even helps to manage clerical and administrative tasks like the ones that we mentioned the other time. So it's a very big complaint here in Canada, and I encourage you to check it out. Sanctuary AI is sort of also in Canada. They say that they've been able to create the first humanoid AI general purpose robots. And these systems are actually meant to perform surgical interventions. And they say that it's general purpose. And they do claim that they have been able to develop some of the systems, and they have them already in their robots, in their laboratory. If you go through the website of this company, they partnered with Microsoft, Accenture, Bell, many of the big players in terms of like big financial players, and they really are making a lot of advancements. Although a lot of people call into question the idea of claiming that they have general purpose robots. But of course, if you read, even if you go online, you would see that there are quite a lot of robots, whether they are sort of like remotely controlled, or they've been able to attain some level of autonomy, in terms of like carrying out surgical precisions and all of that. So the next one we'll look at is skin vision. They use AI to detect skin lesion, particularly cancer. So for example, this kind of system, technology, if you have maybe a spot on your skin, you can take your phone and put it, it's going to scan it. And of course, because the system has been trained with, vast, amount of pictorial data of how particular kind of diseases look like on like the pigments that arises on the skin of the person. I'm saying. All right, so I'm just checking the chat. So these kind of systems, if you put in your phone and put it on the screen, they're able to sort of like detect and make predictions that this is likely, this, or this is this kind of pigment, matches with, maybe cancer, symptoms of this, different kind of predictions that they can make based on just looking at the pigment without even opening up the person and seeing what the problem is, without it being already very self-evident. These systems can be able to pass through that skin lesion and make predictions that this is likely the disease that the person has, or the infection, or whatever. Ubenwa is actually very, it's also here in Canada. It's actually in Montreal. It was created by even a Nigerian, Charles Onu. And they've used the system in many countries, even Nigerians are also there. But what this system actually does is that it can detect, infant neurological diagnoses or diseases based on, like infant cry. So for example, the system actually listens to the cry of the baby. And based on that, it can tell that there's sort of like a neurological problem, for such children, especially between 0 to 6 months. So what this does is that it quickly, increases the risk of medical intervention for such kind of children. And it's actually a game changer. It's a very, very big company here. It's been done by by 2 Nigerians and 1 other Canadian here. So Neuralink, it's a very popular one that Elon Musk complained. And what they do is they use, very high advanced systems of algorithms to translate brain intention into actual commands. They use it mostly for people who are quadriplegia. I mean, these are people who are really paralyzed, especially from their neck, and they are unable to move their hands. One person, I've actually gone through got certification to go through the process. That was done last year. And this guy was able to, you can go online and just check, this guy was able to, they implanted certain computer chips into the brain of the person. And without having to move the hands, the person can use the system by just thinking. The system can detect, brain signals that actually translate into, movement of hands or blinking of eye or every other things that, usually we do. So this system has been able to sort of like, there's been some progress in that, Neuralink is actually doing an incredible job in that sense. 2 people have actually undergone the process now. It was just, I think, early August, 2nd person in the process of brain implants. And, it's a game changer for people who are paralyzed, because now they can use the system, they can use their laptop. They don't need to ask anybody to help them. They can just sit down, relax, and think about moving their mouse, and the mouse will move. It looks like, sort of impossible, but really, it's you can go online and check it. It's incredible. So Butterfly IQ3 is also a AI-powered, handheld, portable, high-resolution ultrasound visual imaging system. So this one is very, very handy. You can go online and check. They have a very nice advertisement video where you can see what they do. Very portable ultrasound visual scan system, where they put it on the maybe in the abdomen. It can produce very, very high quality image of the internal organs of the person without actually having to open it. Of course, about CT scans, where they sort of like do CT scan, you see the very big machine. But this one is very, very portable. You can hold it. It's easy to move around. So even first responders can actually use it. People that are using that are attending to people as first responders. So you could even in the nearest future become part of the first aid toolbox, where everybody can sort of like just check, what did you hit this morning? Have sort of concentration or check if your food is digested. So it's a very, very, it interesting system. You can check it out online. Also, this NVIDIA Boots, it's an AI nurse assistant. It's 24/7 available. It can monitor patient vitals, monitor their use of drugs, and make recommendations, provide reminders for when they are supposed to use their drug. Which is sort of like the typical routine work of a nurse. So you think about like what I mentioned the other time about shortages in nurse. These kind of systems actually sort of like reduce error, especially when the patient is supposed to use drugs at specific intervals or timeline. It can provide reminders, it can make suggestions, it can, it's work remotely even for patients that are not, if the person is an outpatient but is at home, nurses can monitor even the person. They can ask questions directly and all of that. So it's quite an incredible technology. So I'm just going to go to the next slide now. After that, I'm just going to, maybe we take a little break of 5 minutes. Probably people are already tired. I've been loading you with a lot of information. Okay, so yeah. Now we've mentioned a lot about we've mentioned a lot of things about how the systems have actually proven to be game changer for the healthcare industry. But many of you would probably be aware, or if you don't know, that there are actually websites that track incident, reports of, risk that AI systems have actually produced, like the risk that they have, caused, maybe injury, deaths, psychological injury, physical injury that these systems have actually caused. So as much as we want to think about how they have been very, very useful, whether in patient diagnosis and in treatment plans, filling shortages, and all of that in the healthcare industry, there are a lot of baths have actually happened, like a lot of incidences of harm that these systems have actually caused in various forms and contexts. So I got this data from, the OECD AI Policy Observatory. They're not the only one who provide this kind of information, but they seem to provide sort of like visual metric, and I like it. I'm also thinking that I'm going to show you the live database, and we would see the trajectory of AI incident reports from 2016 down to as at July 2004. So if you look at it here, this is the total of, see if I can. So this is the total of try to get my sorry, I lost my screen. Okay. Yeah, so this is the total of like between 2006 to 2016 to 2024, the total number of incidents of AI incidents and hazard that has been reported, at least based on the OECD report, is this, this 419, and monthly updates is usually this current month, which is August, that has not even ended. They've already reported 13. Last month was 23. So if you look at the trajectory here, you would see that there've been sort of like a spike in incidences of harm or hazard that these systems have caused. This one specifically to healthcare industry, healthcare, drug, and biotechnology. My plan is actually to show you the live database. I'm just going to try and do that now. Okay. All right, so can you see my screen? If you can see the screen, please. If you can see the screen, please, you can just confirm in the chat box, or you just say so. All right, thanks for that. Great. All right, so this is the OECD database for air incident monitoring. This is already put it in healthcare, so you can come here and check. This is for healthcare. You can check the kind of harm that has been caused, whether it is reputational harm, public interest, human rights, or non-physical. And you can check the level of severity, whether it's by death, that's caused death, injury, hazard, non-physical harm. And if you check the thing, you would see that it continues to increase seriously. This is the peak. 40 was reported as of January. 40 incidents reported. Come here, check the level of deaths that AI has caused. This is serious. From 2023 to this as of last month, 3 deaths have occurred, at least based on the use of AI system. And if you look at this heading here, you will see a surgical robot born to wife intestine and caused her to die rather. So a lot of things happen with these systems. They are not foolproof, and they continue to cause harm. So I'm just going to go back to my other screen. I'm going to go back to my PowerPoint. Yeah. Yeah, absolutely. The incidences have spiked because, like you rightly said, Moses, because AI systems have proliferated in the past few years. All right, I'm just going to go back to my slide. Okay. Okay. Yeah, so let's look at why these things happen. Why does it happen? Why do you have these incidences of death, injury? Why do we have it? So I'm just going to show you a video. I hope you can all check it. It's a short video. After that, I'm just going to open the floor. I'm going to ask if we can have a couple of conversations, and then we would have a short break. Yeah. Please let me know if you can see my screen. Can you see the video? Can you see the video? If you can see my screen, please.
Yes, sir.
All right, great.
Excuse me, sir. I'm not sure
Yeah.
if, yes, I'm not sure if you have played it, but I can't hear anything from the background.
Oh, interesting. What about others? Can you see it? Can you hear the
We can
sort of?
see it, but it's not playable.
Really?
I don't know if you've played it.
I did already. I already played it, and I can hear it from my end. Sort of like surprised. Well, it should be. Try again. Can you see it now? I'm kind of, this is sort of like strange if you can't. Please just leave a message in the chat if you can hear it. Oh, wow. Okay, yeah, I think this is a very important, video for you guys to watch. I'm just going to see if I can pass it directly through YouTube. 1 second. Let me see if I can get it to you guys. It's very interesting. Okay. Okay, so let's see if you can see this. All right, so can you see my screen now? Please, if you can confirm if you can see the YouTube video. Did you get the audio feedback now? Brilliant, yeah. Thank you, thanks for that. Yeah, thanks for that. So I'm happy you guys can hear now. So I'm gonna start it again and just
I'm sorry, we can't hear anything from the video.
Oh, that's strange. I guess a couple of people said they can. Can you, I thought somebody said they could hear the video. I'm wondering what the issue is.
We can hear you, but not the video.
That's strange. I really don't know what the issue is, but it should. I'm kind of surprised. Oh. Okay, so maybe what we can do is, because I actually intended that we could use this video to sort of like have some conversation. We can sort of like go on a 5-minute break. I hope I'll be able to fix the technical issues if there's any before that time. And yeah, does that work with everybody? Okay, so we'll see in next 5-6 minutes. All right, thanks. Okay, yeah. So I think we should be back now and we can go on. Can we go on now? I hope we can get back. All right, brilliant. So I think I was able to find the forms. Okay, yeah, so thanks. I'm just going to share my screen again. I think I found the reason, and so hopefully it works fine this time around. Where's my screen? This one. Okay. So let me know if you can see my screen this time around. Okay. Yeah. Can you see the screen? Please just leave a yes or no in the chat box. Okay.
A recent
Did
study
you get this?
published in Science magazine found significant racial bias in an algorithm used by hospitals across the nation to determine who needs follow-up care and who does not. Megan Thompson recently spoke with Stats Shraddha Chakradhar, who explained what the researchers found.
Great, brilliant. Yeah, thanks for that. All right, so I'm just going to start it again and then we can.
A recent study published in Science magazine found significant racial bias in an algorithm used by hospitals across the nation to determine who needs follow-up care and who does not. Megan Thompson recently spoke with Stats Shraddha Chakradhar, who explained what the researchers found.
Where exactly was this bias coming from?
There are two ways that we can identify how sick a person is. One is how many dollars are spent on that person. You know, the assumption being the more healthcare they come in for, the more treatment that they get, the more dollars they spend, and presumably the sicker they are if they're getting all that treatment. And the other way is that, you know, we can measure actual biophysical things, you know, from lab tests, what kind of conditions or diseases they might have. So it seems like this algorithm was relying on the cost prediction definition. In other words, the more dollars a patient was projected to spend on the part of an insurance company or a hospital, then that was a sign of how sick they were going to be. And that seems to be where the bias emerged.
I understand that the researchers then sort of reuse the algorithm using a different type of data. Can you just tell us a little bit more about that? What did they use?
Yeah, so instead of relying on just costs to predict which patients are going to need follow-up care, they actually used biometric data, biophysical data, physiological data, and they saw a dramatic difference. You know, in the previous model, the algorithm missed some 48,000 extra chronic conditions that African American patients had. But when they rejiggered the algorithm to look more at actual biological data, they brought that down to about 7,700. So it was about an 84% reduction in bias.
Do we know anything about how the use of this biased algorithm actually affected patient care?
We don't actually know that, but as I mentioned, the algorithm is used by hospitals to help them flag patients who might need extra care in the coming year, whether it's, you know, an at-home nurse or making sure that they come in for regularly scheduled doctor's appointments. So we can only presume that if sicker Black patients weren't being flagged accurately, that they also missed out on this follow-up care.
Are there any consequences for the company Optum that was behind this algorithm?
Yeah, so the day after the study came out, actually, New York regulators, the Department of Financial Services and the Department of Health sent a letter to the company saying they were investigating this algorithm and that the company had to show that the way the algorithm worked wasn't in violation of anti-discrimination laws in New York. So that investigation is pending. One encouraging thing is that when the researchers did the study, they actually reached back to Optum and let them know about the discrepancy in the data, and the company was glad to be told about it, and I'm told that they're working on a fix. The other encouraging thing is that the researchers have actually now launched an initiative to help other companies who may be behind similar algorithms to help them fix any biases in their programs. So they've launched a program based out of the University of Chicago's Booth School to do this work on a pro bono basis so that they can sort of catch these things in other algorithms that might be used across the country.
All right, Shraddha Chakradar of STAT, thank you so much for being with us.
Thank you for having me.
A recent study published in Science magazine.
Okay, yeah, so Paul got that. I think it's quite fascinating. It's a video done 4 years ago, but I mean, we just saw, I mean, the latest news on the OECD incident and data observatory still showed that just last month somebody died. You know, the robotic, you know, through use when they were conducting surgery using a robotic AI system. So it's still a very perennial issue. I was just wondering if anybody had a comment or if you thought that, you know, if you followed the conversation, you would see that one of the reasons why they had the problem was because they were using, you know, healthcare costs to determine, you know, prospect of like the patient's sickness level in terms of how sick they are or how much healthcare need they would need for the next year, as the case may be. So, do anybody think that was wrong? You know, do you think the methodology they used to determine how sick a person is, which is using how much they spend on healthcare to determine, you know, the interventions that they sort of use? Would anybody be happy to make a comment about that? You can do that in the chat, or you can just raise your hand and just.
All right, I hear.
Yes, I can. I can hear.
For me, I think the feature they put into consideration while developing such a solution is actually a little bit correct, because if you're having headache, the cost of treating headache is relatively small compared to the cost of treating cancer. So reasonably, I think it's correct, but I don't know what more to say, but I kind of feel like they are reasonably correct. For if you put into consideration other measures to kind of maybe filter a lot of things, I think can then come against them and say this is not enough as a policy to validate. For now, maybe I'm not thinking too deep yet. I think there is a correlation between the cost and
I don't know if that makes sense.
Well, I mean, thanks for that. I really couldn't catch who made that comment. Maybe if you want to talk, you can just say, "Oh, my name is Dami," and maybe you're talking from Nigeria or from somewhere, or, so that we can know who spoke. All right. So I didn't get your name. Yes. Okay. Somebody put it. Okay. Are there some diseases that are known to within a particular class? Yeah. I mean, yeah. There are some diseases that are very peculiar to specific race, and there are some that are peculiar to people based on their geography, where they are. For example, like here, malaria is not prevalent because they really don't have so much mosquitoes, and malaria here, for example, it's like a death sentence. So some diseases are sort of like prevalent to specific demography, maybe in terms of, especially in terms of their race. They have different skin pigment, and so sort of like our needs are particularly different sometimes from each other. So I hope that answers your question. Yeah, so I mean, I don't know if anybody wants to also make any comments about the methodology they used, the sort of like the cost, methodology. If you are spending more money on healthcare, supposedly the assumption would be that you probably are more sick, and I think that methodology is a little bit fair. It's fair, but they still had serious problems. Think about it. It says it missed up to 87,000, points of that they could have discovered, sort of like diagnosis that they could have, especially some diseases that they missed a lot. And when they sort of like rejig the whole system using physiological data or other forms of relevant data that are necessary, they sort of reduced the issue down to by almost 80 something, 4%. So the whole issue is just around systems that we currently have. They are mostly data driven. In fact, they are all data. And so they sort of like implicate the kind of output that you find, or the predictions that the outcomes that sort of arises when the systems are used. There's another video I wanted to show you, but I think we've fast spent time, so I'll just the next one. Maybe if you. So now there is wonder, like, why is there debt? Why is there biases? Why is there injury to the persons? The reason why the systems were introduced is actually to aid debt, to sort of like what they call precision medicine, personalized medicine. It's all about providing better healthcare for people. So why do we still have this problem of people dying? So usually in the scholarship they call it conduct of bias. Like channels through which bias enters into systems. So we have sometimes is lack of standard of fairness. There is a lot of problem about what is fairness in AI, and which is sort of like a buzzword. It's very, very challenging. What is fairness? How do you measure fairness? Do you measure fairness based on, equal outcome to people of the same, demography? I hope you can see my screen. Can you see my screen? Sorry. No, I didn't share the screen. Sorry. Yeah, so this should see my screen now. I'm just gonna rush through this. 1 second. So. Okay, yeah. So can you see my screen, please? If you can see, please just type yes. All right. My PowerPoint slide. Is anybody still there?
Yes.
Yes, sir.
All right. So you can see my screen. I just want to be sure that you can see. All right. So what I'm trying to say is, so how does this, incidences happen? What are the causes, and how does it sort of like, perpetuate harm and injury to people when initially the intention was actually not to use it for that, at least averagely. So the reason is sometimes questions around like lack of fairness. How do we measure fairness? And how do what sort of metrics or indicators do you use to determine that the system is fair? Is this based on producing the same outcome for the same set of people, or for specific demography? There's a questions also around, what is fairness, what is equality, what is equitable, and in what context, So it's a lot of problem, and you see many companies, even Microsoft, OpenAI, Google, coming up with different fairness metrics using technical, what we call technical solutionism, to address these issues by also using certain algorithmic systems to also determine the system, which is very, very problematic. I have a publication that is coming out very soon that sort of like look into this issue of, how we cannot address some of these issues using technological methodologies or algorithmic fairness approaches to determine if a system is actually fair. And rather, we should be conducting more ethnographic and anthropological research that looks into sort of the social science dynamics to these issues. So there's always a problem about how do we measure parity? Is it by outcome, or is it by impact? If it impacts certain people more, is it fair? Or if it's produce the same results. For example, everybody who were Black in America, in New York, who were tested with that system were all impacted. So obviously there is sort of disparity in the ways it makes its own predictions or diagnosis for white and for Black people. So obviously that looks very clear. So the problem is we still have to sort of like think about our question of what fairness is. So it's very, very problematic. The lack of context is, is very, very, lack of contextual specificity, which is that, and this comes down to sort of like the kind of data that you get, making sure that the data actually address the specific needs and features of the people who are supposed to be users of that kind of system. So you can't just gather data. You have to make sure that the data fits the context. It has to be robust enough. It has to be toned properly, to meet the expected outcomes that the model designers are seeking to achieve. So it is important to sort of take into context the specific features of the people who are users of the system, and that's sort of like makes it very problematic. For example, like many of the systems are being developed in the US, and they have transboundary implications. They will soon be imported into Africa, and a lot of data are actually missing. We don't have enough data collection systems from our own, region, which makes it very, very difficult to just transplant the systems without serious evaluation before that. So context is very, very important. What context was the system developed for? What kind of data was used to train the system? Some of these things help to sort of like determine questions of fairness or questions of equitableness. So another one is sort of like the opaqueness of the machine learning system. You would have learned black box, for active AI system, very, very complicated, that even the designers themselves, the model designers sometimes can't even explain how the system was able to, especially in machine learning systems, deep learning algorithms, where it is very, very difficult to even determine how the system came about with the decision that it made. So if that is problematic for model designers themselves, think about for end users. And we know that, as we would even discuss further, the questions around explainability, transparency, intelligibility are some of the sort of like core foundational ethical standards that, is being discussed in the governance space. So it's part of the causes. Now, the results, like we've seen, is erroneous diagnosis, health discrimination, healthcare disenfranchisement, and even. So if you look at what I display here now, like the conduct of bias are actually, first of all, from data, but the data exists in the world. When we collect data, human beings are themselves biased. So the data is, the bias comes from the world. It comes from who we are. We all have prejudices. We all have, preferences. And usually we are blind to certain things. We are open, depending on our background, training, social factors, and a lot of other things. So this bias thing is not just even for people of color and all of that. It can impact anybody. It could be detrimental to both white, to anybody, irrespective of whatever they associate themselves with. So the data is, by reason of the fact that there is bias in the world, it's also translating to the data, and sort of like what we call historical bias, representation bias, and all of that. So it goes into the data, and then the data is sort of like introduced into the machine learning system. And even during the time of sort of like human review, there is still, bias. For example, there is always this governance standard of making sure that human is in the loop. But even there is still automation bias and all of that. That makes it a little bit difficult for people to identify that indeed maybe a system could produce bias outcomes or produce bias impact. I'm just going to rush. So how do we address some of these things? There are a lot of like technical solutions. For example, ensuring that there is data triangulation, which is making sure that you take data from very diverse points of view. Design a system that is designed to be multi-purpose for different demographics, and you must make sure that you collect data from different diverse perspectives. Proactively identifying edge cases, which is, edge cases usually like understanding nuanced contexts where the system could be used. For example, if you think about how the system, for example, could misdiagnose people who have maybe peculiar physiological characteristics. Maybe they have a bigger skull, or they are taller, than the average. So you have to sort of like understand the edge cases to ensure that the systems, you are able to sort of like imagine. I mean, this is sort of like imagination of situations that are sort of like unusual, and making sure that the systems are trained to, accommodate such sort of like incidents that are unusual or novelty and all of that. Obtaining high quality data, accurate and consistent data annotation, understanding where and why your model is failing, and constantly checking on your model. So sort of like in checks and all that. So these are sort of like technical interventions that usually are being used by developers to make sure that systems they use are less biased, or bias are mitigated, even though it's very, very problematic. used. So let's quickly run through sort of like governance interventions. So I put it in governance framework, international, regional, and then we also have general and specific. So we all would probably know, based on the trainings you've had or teachings you've had in the past few days, that there are international ethical principles that are really not binding, but they sort of like guide the vision of how AI systems are created. So we have the OECD AI principle that at least certain principles around ability, principles around robustness, security, and safety, even though they're all contested issues and state practice them from different perspectives. Particularly in the health care, from an international perspective, there's the World Health Organization Ethical and Governance of Artificial Intelligence for Healthcare Guidance, large multimodal models. It was released just this year in January, but it's also sort of like an international framework that guides the vision of how states are supposed to develop their own domestic policies and regimes and strategies dealing with these systems. I'm going to go in details into some of them when we. Then you have the FDA, Food and Drug Agency guidelines. It was also this year. So you see that some of these interventions are really very new, despite the fact that these systems have been used for quite a while. Then you have regional regulations like the EU AI Act, and also at the domestic level, you have national AI strategies and policies, some of them that address issues around health. So let's look at WHO, because WHO is actually the international body that has the responsibility of regulating healthcare at the transnational level. They provided 6 key governance principles that must guide the development of AI, development and deployment of AI systems. One is to ensure that autonomy is protected. So the idea of autonomous robotic systems, they actually dispel that human must always be in control. So it could be sort of like remotely controlled robotic systems, and there should be opportunity for intervention as quickly as possible for when those systems are being used. So it must be able to protect human well-being, human safety, and public interest. Principles around transparency, explainability, and intelligibility is sort of like core. Explainability, they're all contested issues, like we mentioned the other time, questions around fakeness, transparency. Many times, these AI systems are developed by, private sector actors, and they sort of like term it proprietary, which in the sense that they can't disclose how the system works because of their IP rights and all of that. So these are questions that sort of like still challenge this principle, but this is the vision that World Health Organization has created for use of these systems in the healthcare. Then it must be such that fosters responsibility and accountability. So, model builders must be responsible in the way they develop these systems, and also should accountability in the event of harm or injury. So you think about like the video we watched the other time, there were already investigations whether it constituted discrimination, laws in New York and all of that. That could be grounds for litigation and some compensation. So it's supposed to ensure inclusiveness and equity. This is another term that is different from usually what we consider fairness, which most people talk about in the context of equality. But here, who is using the word equity, which is another word that sort of like takes into context individual circumstances of persons, and rather not just comparing them to looking into their sort of like an individualistic approach to the way talk about impact and outcomes that the system produce for individuals alone, and not putting them in groups. So it's supposed to promote it must promote responsiveness and sustainable. So those are some of the ones you find from World Health Organization. You can check also the EU AI Act, which is sort of like the only international regulatory framework that's sort of like taking the position of law, sort of law, hard law, as we consider it to be in international law. The EU AI Act, came into 1st of August this month. It came into first force, but it's not going to be effective until August 2nd, 2026, which is another issue. But it sort of like use a risky-based assessment framework. So there are different levels of risk: unacceptable, high risk, minimal risk, and all of that. And healthcare, actually, the use of AI in healthcare systems is considered to be high risk. Is tiered as high risk system. So because of that, the compliance requirement is actually higher. So there's strong requirements related to risk management, third-party certification by independent assessors. So before you deploy the systems, sort of like independent overseers are supposed to look into it and assess, the fairness or impact or the responsiveness of the systems. Very strong data quality and integrity and security, technical documentation, ensuring that there's always human oversight. So AI sort of like considers autonomous systems within the healthcare systems that should not be used. So those are some of the regulations that you find at the regional level that provide for regulation of AI in the healthcare industry. If a company fails to comply with these regulations, for example, making sure that they have a very risk management framework that shows that they were responsible throughout the development process of the system, it's a fine. It could result in a fine. They have to make sure they have a very strong data quality and integrity and security system. So it's not like they don't have very strong cybersecurity system that allows hackers to, for example, infiltrate the system and dilute, the data or screw it up, and all of that. So there's very strong, I suppose, accountability regime for failure to comply with the EU Air Act, up to 35 million euros in penalty for non-compliance, and it could be, or in the alternative, 70% of the global turnover of the company. So if you think of maybe like Microsoft, for example, which is its annual global revenue as of March 31st this year was $236 billion. 7% was just going to be 16 million. So I mean, there's always a question of, does it provide a very strong deterrent against deployment of the systems or compliance with the regime? Maybe that's another conversation. Last one, I'm going to talk about sort of implicatory regulatory frameworks. Human rights and data protection regime also sort of falls into this regulation interventions. Like you have national human rights laws and constitutions. You have data protection laws that companies are supposed to comply with. International covenants and civil and political rights provides for right to life. So even if, for example, the person who was killed by the robotic system, they could bring a claim before the Human Rights Committee on grounds of breach of covenant of breach of civil and political rights. They could also file actions not on the basis of sort of algorithmic harm, but rather maybe on the basis of negligence, as the case, which is going to be like a conscious life. So international covenant and civil and political rights convention against all forms of discriminations against women, human rights, Africa Charter of People's Rights, the AU Convention on Cybersecurity and Personal Data Protection. All of this, regulations, they all have these laws, covenants. They all have sort of implicatory regulatory influence on AI systems in general. So a lot of work is being done. There's still a lot to be done, but these are sort of frameworks you can consider that provide for making sure that developers act responsibly, or as the case may be, ensure that there is accountability regime for when there's breach. So I think we spent a lot of time having this conversation. I really enjoyed it myself. And yeah, we can just have a couple of chats now and see if there are comments, questions, and feedbacks, interventions. Like I said, if you want to say anything, just introduce yourself, name, and yeah. We'll do that for like 5 minutes.
Thank you. Can you hear me?
Yes, I can hear you.
Yeah, so just a little bit curious about solutions, AI solutions being used particularly in the healthcare sector. So, do you think of one time the users, I mean maybe the doctors, the lab scientists, and others, they actually check for biasness in the newly shipped into particularly in Africa because most of these solutions they are being developed out there and not really with our own data. Now they are assessing and making predictions whereby a particular patient is having X or not. Like, what do you see to that? And don't you think it's necessary for them to put in checks and even at the ground level?
Yeah, I mean, I think that's a very, very important question, and it's part of the conversation that are going on at the um, at domestic levels. And different African countries are trying to put in place systems that allow a lot of domestic auditing of the systems before they are used. Obviously, medical practitioners really don't have technical backgrounds, so it's a little bit difficult. It's all about making sure that before the system gets into their hands, they've been, audited. There's been a lot of sandboxing, a lot of red teaming to ensure that the systems are fit, before they are deployed for the general public. So I think some of the things that needs to be improved more, because as it is now, like I said, I do have a paper that is coming up very soon, and it was more about like how we can sort of like improve financing for global governance of AI. And if you look at the data from Stanford AI Center, and even some other organizations like the OECD, if you check their database, you will see an investment landscape for AI development and research. There is serious disparity between what we have in Africa and what you have in the other part of the world, like the US and China. They are sort of like the top leaders, and they are the ones who would define that discipline in the next few years before African countries catch up. So what is important is, how we can sort of like develop frameworks for example, at the domestic level, make sure that we develop systems that collect proper data and helping, developers in the global north, which is like in developed countries, to have access to that kind of data. So there should be sort of like data information sharing systems that allow, even though there are some systems like that at the moment, but they are not very comprehensive. So sort of like strong data collection systems should be the focus of robust data collection should be the focus of many African countries, and making it available for developers, both in the global north and even for domestic developers. So I think those are some of the things that can be done to mitigate some of these problems. I hope that answers your question. Those are some of the things I was able to pick.
Yes. And secondly,
Yes.
do you think the issue of biasness can be fully resolved? Now, given that it's what I have available that I can use to train my machine learning or AI model. So if I don't have much data from a particular province, or they don't have the prevalence of that disease in that particular province, and there's a particular province or many other provinces that are having the prevalence of that disease, am I biased in building my model based on that?
Yeah, I mean, those are questions that I think it's also a very important question. And I mean, responsibility as a governance standard, it includes questions around due diligence, which is making sure that you use systems that are built on robust and diverse data sets. So by implication, if you're going to extend the user base of your systems to people beyond the region where you have robust data for, then that's going to be problematic. The system should only be used for demographics or regions or geographies where there is enough data to, address those kind of issues. There are a lot of interventions that have been introduced now to sort of like patch work, like synthetic data sets, which is sort of like artificially constructed previous data sets and all of that to, mitigate for data scarcity. But they still are not very, very effective. So I think that what is important is making sure that the systems are used only within the context where the data sets are confidently robust enough. And I think that is it. And then in terms of like reduction of bias, I don't think it is possible to reduce bias. I don't think it is possible to eliminate bias. I think what is important is bias mitigation, because it's just a factor of the word. The word is itself, like I showed you in the other slide, this data come from the word. This data didn't come from mass, or the bias didn't come from mass. It didn't come from Pluto. It came here. We all have prejudices. We're all producers of data. The methodology by which we used to collect data itself can be prejudicial. It doesn't have to be intentional. It could be unintentional. And in fact, it is always the case most of the time that the data are collected in such a way that the methodology excludes certain vital, components that makes it, ineffective. And the business model approach to AI commercialization makes it, difficult for, developers to not deploy their system, even when they know that, there are some limitations to the model. They want to make money, and all of that. So I think the approach at this point is to see how to mitigate it, rather than, building an utopia, assumption about total elimination. You may have a different position, but I think that is the only way forward. Yeah. I'll take one or two more questions, and we can or comment on dimensions. I think there's a comment. Box. Right. Somebody said, okay, what are the thoughts on auditing the auditor? I see some discrepancies there. That move in itself, IT bias. Well, the thing is, at one point you have to end with, who audits. So, for example, I am a member of the Research Ethics Board, and I review regularly medical research. So some people have said that, there should be somebody also auditing what I'm doing, which is funny. The whole idea about every institution is built around trust. The problem with private industry, this profit-oriented AI industry, especially with the way the American model is designed, it's very, very difficult to trust corporate-backed AI investments, because it's all about profit. It's all about profit maximization. So usually auditing them is very important. And some people have actually recommended developing sort of like the same way we have research ethics board, medical ethics board. We should also have research AI ethics board, which is in this case maybe at the institutional or university public funded research. It should be used, and also in the context of like private development of AI system by private actors, there should be sort of like third-party auditing of the system. It's already like the system. If you want to develop, if you want to, before you release a drug into this, into the market, you have to get approval from NAFDAC. In the context of Nigeria, you have to get approval from the FDA. So auditing the systems are important. Auditing the auditor, it's you know, it could be a safety net, you know, in circumstances where there's manifest, you know, evidence of conflict of interest. But I think it's still a very strong step to, you know, addressing some of these issues. I hope that looks into the issue. I hope that addresses I mean, obviously, I don't think. Do you mean that it won't heighten or it won't mitigate? I see some discrepancies there. Opposition and institutional oversight in auditing of the IK. Do you think that? Well, I mean, I don't think, maybe, I don't know, maybe it's a question that is not very clear to me, but I'm trying to sort of interpret it. Are you saying that, you know, do you want to talk to this question? Who is the person who asked the question? Maybe you know, explain it. It doesn't seem very clear.
Hello, sir.
Yep, yep.
I was wondering, is it the question that or the comment I dropped about the OECD data repository, or?
No, I can't see anything about OECD here.
Yeah, it was when you were discussing that OECD data, I can't really recall, observatory something.
Yeah. Okay, what about it?
I was just saying that, but you have already settled the matter, right? You played a video where they tried to explain the reason why the incidences are going higher.
Absolutely.
Yes, algorithmic bias was the major problem that they discussed there.
Yeah, and a lot of it also, I mean, think about it. The way I sort of explain to people is like data is sort of like the life wire of, you know, machine learning systems. They all live on wire. It's like this. It's like the spirit of AI system. It's like the fuel of an AI system. So if the data is queued, it's simply, you know, sort of like at some point, sort of garbage in, garbage out. You know, the whole idea is sort of like making sure that there are regulatory systems that make sure that data are collected in a very structured way, that they are, you know, robust enough to accommodate different needs and peculiarities. Yeah, so I mean, somebody raised hand. You can see, I'm not sure if I got the pronunciation very well. It's Lois.
Yes.
Yeah.
I wanted to get your opinion on these two issues. The first one is, you mentioned the use of Neuralink, and I wanted to find out what are your thoughts on in the aspect of computer-brain interface, hacking into person's databases and the implications that could have on a person's health and their well-being. Then the second question I wanted to ask was regarding AI assistants, the use of AI robots and all of that in healthcare. I wanted to find out what are your opinions on how they could possibly replace human beings and what this could mean, because, you know, there have been some complaints. I've seen some complaints in some advanced countries where some of these AI have been deployed, that they're taking over job from maybe care providers. And sometimes some people say that they may not be able to give the human warmth or care that is expected. So what are your takes on these two issues?
Well, I mean, thank you so much for that. I think, I mean, a couple of fascinating things you mentioned, which is sort of like when we, this idea of neural brain computer, interface, sort of like, or integration, it's really mind blowing. It really pushes the boundary of, and current practices, medical practices, and it really does raise a lot of crucial questions from an ethical perspective, because you're thinking about a human being who now is attached to a system, and if you think about it, if you watch the video of the first participants of Neuralink's, trial for brain implants, they actually could access they gather data from that person's brain, like every time, like they're collecting different signal data from the person and all of that. But I mean, this is questions around consent and all of that. But it also comes down to the question of, whether we really need things like this, and whether we should, at some point, stop certain things. Like you said, there's a possibility of manipulation, sort of ethical manipulation, because this person is now connected to a server, and so it could be hacked, the person could be taken over, by a system, and could be used to cause injury to other people, in whatever sense. We're talking about this in the context of people who have paralysis, but the way things are going now, even people who have 2 legs want to be augmented with AI systems. They want to be implanted with certain things that maybe reduces their aging and all of that. So, these are conversations we I think continue to have. On a personal level, I think that stopping the thing is not actually what stops it, because you actually don't stop anything. People will still do it. But what is important is to put in place very strong regulation, especially in the context of like people who are, integrated into neural network systems, making sure that they have very strong cybersecurity regime, and putting that person in control of, how the system, when the system works, when it does not work. And yeah, I think those are some of the issues that needs to be considered. It's a very, very controversial issue. Like you said, mental privacy and all of that. So, I mean, I think we shouldn't stop it. I think what is important is putting in place systems that allows for strong regulatory interventions, like putting the person in control, making sure that they are very strong cybersecurity programs that make sure that the person is, secured, and that there is no, breach of mental capacity. So, for the other one, which is on the north, I did provide the statistics the other time that in Canada, for example, the statistics as of last year is that there will be up to 115,000 nurse, deficits by 2030, and that by 2030 there will be the need for, up to 13 million nurses all over the world to meet up with World Health Organization standard. So the idea of AI systems taking jobs, it's actually now tested, at least based on that statistics, but you never can tell, how these things are going to impact the job market for nurses. At least there's a lot of spaces that is filled. So I don't think that there would ever be a time where nurses totally fix it out of the system. And more so, governance, interventions, at least from what we saw from rules, guidelines, just this year, is the idea of human autonomy. So the use of AI systems in the healthcare industry, if we follow the trajectory of policy, governance, policy and regulations, it will be a system that's merely augment, not necessarily completely take over. So there would still be human in the loop, because it's an high-risk sector, there's still need for human to be involved in the process. I think that is what we do in that next. I hope that speaks to your concern, or if you have any other thing you want to mention.
Yes, it does. It does. Thank you.
Yeah, and I don't mind. What do you think? What's your own position about it? Do you have a different perspective on how we should think? Do you think we should ban, brain implants completely? Like some people have been advocating for the banning of facial recognition technologies completely, or some other technologies should be banned completely. And some people say it shouldn't be banned; it should be regulated. So people have different positions. Do you have any position?
I think it's we can't necessarily ban it, because we see the importance of these technologies for persons that are maybe handicapped, living with disabilities. So we can't totally eradicate it. But I do think it's a very slippery slope, because there's so much we don't understand on neural networks and how they come about their decisions. There's so much we don't understand about how AI is able to learn from us, predict what we are able to do. So if these these devices, because technically these persons using these devices are like cyborgs, because they are merged with these technologies. In the long run, we don't know, we are not able to project how this could impact them and how the machine could behave. But at the same time, I think while we're looking at regulations, there needs to be much more pressure on developers of these technologies to try to understand how they perform, and the black boxes, understanding behind the scenes, because that's the only way we can predict what they are going to do. I mean, regulations can only expect the worst, but we can't know how to steer things towards the worst way in the regulatory aspect, right? Until the developers are able to tell us these are the capabilities of these systems, then we're able to see. But for the second question I asked on AI assistant, I think that was a very interesting that's a very interesting top take, because I read something somewhere. Naturally, we would say that these robots wouldn't be able to replace humans, but I read something somewhere where they conducted a survey in a care home for elderly persons, and many of these persons said they prefer to interact with robots than actual humans, because most times the humans will either be too tired or they will be too exhausted. But then these robots could be very creative. They could come up with games while they were talking to them. So they preferred the robots, which I thought they wouldn't, from a just from a rational perspective, right? You would want human interaction. So I think that one is very interesting. There's research going on towards it, but I do think that very soon we may begin to start seeing robots as human beings, ascribing them with certain rights that we ordinarily would not think of right now.
Yeah, I mean, absolutely. You made a very brilliant point. I mean, some of this thing comes down to like maybe preferences. Maybe at some point it would be, patient wants to subscribe to a robotic nurse, they have it. If the patient wants human care, they have it, and it's all about the idea of human flourishing, but at the same time ensuring that there are mechanisms to make sure that developers are being truthful because about capabilities of the system. Because one of the things you see, there's a lot of hype. There's a lot of what we call mere puff, where the capabilities of the systems are bloated beyond what they really can do to drive attention. So, and there's a lot of lack of understanding, like you said, in these spaces. So it's still difficult to upscale them to general public. So if you look at the neural link program, for example, it took a long time before they could get approval for the person to go through the process, and they had to do a lot of screening, a lot of assessments to ensure that the person actually fit, and the person survived. And although there were some reported incidences of problems, but the latest video of the person seems to be very fine. And just even on the 5th of August this month, another person went through that process. So it is by doing these things that more understanding of how those systems work come up, and then you can begin to build standard practices. It's just like normal clinical trials as well in medicine.
Sir,
Yes.
I want to add something. So it's also important to answer the question whether we need the technology and should we even proceed if we need it. Because like, for example, the previous participant talked about care robots and how they replace human beings. In some scenarios, it's very possible that care robots are not even needed. Like, I just feel that there should be a threshold to what type of illness should we use, for example, neuro links technology. If it's just for mere luxury, like the recent model that was advertised by Apple, it's connected to Neuralink technology. Do we actually need it just for the sake of luxury, the affordances that the technology itself can offer to us? So when deploying this technology in healthcare, knowing that healthcare is significant to the life of that person, it's important that we answer these critical questions and also consider the threshold of that sickness. If it's paralysis, if it's stroke, yes, very well, we can use it under certain conditions.
Well, I mean that's a good one. I agree with you. I see points in what you're saying, that usually there's always like, where is the boundary? Where do we draw the line using usage of the systems, especially because of their invasive capabilities. Yeah, but it's still. I mean, the conversation is still going, and I mean that's one of the reasons why we're having this kind of chat. I mean, it's even very easy to still talk about, to still say, okay, let's use it for people that are sick. What about people that are not sick? If somebody is not sick and he says he wants to be connected to a company, do you stop the person? Do you say the person should not be allowed to go through such a procedure? If somebody says he doesn't like his 2 legs again, he wants a robotic leg that makes him faster and do you think you should stop it? So those are still a lot of questions that still, and a lot of people have said it, that, we've, over the years, there have been a lot of systems that have been introduced to augment human capabilities. For example, cars, even cars are they are technologies that augment our capacity, our mobility. We should be using our legs, shouldn't be, using cars. But out of necessity, to improve our ability to move around, we started developing cars and all of that. And now we just drop, our legs are not the one walking up. So over the years, there have been a lot of systems that we were even born into the world understanding. We just saw it as normal, but actually they are augmenting systems. They are systems that are meant to augment human capabilities. What about, glasses, for people who feel like, they want to see things better. What about microscope? They all augment our capability to do something. So there's still a lot of questions, like ethics that sort of like think about, whether not only even in the context of putting the threshold on what kind of diseases they should be used for, but also if a person that is healthy but wishes to be connected to a network, or, implanted with certain chips or that kind of thing, should we allow that? I mean, those are food for thoughts, but there are quite a lot of things. Yeah, I mean that's Rachel said maybe the decision should not be on the person alone, but companies developing should say who and where it can be used. I guess like use regulation can be important. Yeah, I mean that's a fair proposal as well. But at the end of it all, there's always a point of where do we draw the line, and those are conversations we'll continue to have. So yeah, I mean, I hope this was very helpful, and I hope you learned a couple of things. And thank you very much for your interactions. Thank you very much for comments as well, and thank you also to the organizers, Kinsley, Wadara, and I think I've been in touch with somebody else. Trying to recall the name now. Retabel. I'm sorry if I didn't get to the pronunciation of the name properly. Thank you for being in touch, and I wish you all a wonderful day. Bye.
Thank you.
Hi, everyone. I do hope you enjoyed the session this afternoon. It was an exciting session. We would draw the curtains from here. A few announcements before you leave. Please remember to get in touch with your group, your team members, so you are able to continue research and let us know if you need any help. Also, the session continues tomorrow, same time. Please try to join as early as possible. And with this, we put the session to a close. Please do have a wonderful day ahead of you. Good evening, good afternoon, and good night from where you're joining us from. Bye.